Dr. Russell Friedman. I'm a chiropractor. My goal today is, if I had a vision, is really to just kind of open you up to an old idea that we have lost sight of. And that is what I'm going to kind of just give you a treat of today. And I think that it's really an important message. And I think that Kimberly speaks about it all the time. So if you tune into her, you'll get it. You'll get it on on higher volume than I'm going to give you, on turbo or whatever. So feel free to ask questions. All right, and we'll go from there. All right. So today's topic is about vertigo and dizziness and Meniere's disease, and really what all three of them are really it's dizzy spells and a sense of this imbalance and motion and feeling uncomfortable and things are moving. It's if you've had too much to drink at one time, it's having that all the time, even if you're sitting down and still. So it's a horrible place to be because there is minimal life there, because you can't do anything. You can't go be active with your family. You can't go play with your children. You can't go take a walk down the street. And it's a tough place. So we have a lady that's next door that I just took care of, and she's just resting, but if she pops in here, she'll tell you her story, and that is that she came in here with dizziness, and whatever the diagnosis is, we'll talk about that a little bit, and she's found a great path to recovery. So my goal here also is to be a realist, and it is not to tell you that if you do this, it will be gone. Okay, because it's just not the way things work, all right? The way things work is that we have to take care of things. We have to take care of things. Everything in your life you have to take care of, whether it's if you have a dog or a cat, or your own personal hygiene, or your car, or your cell phone after you drop it, okay, or plugging it into the phone, to the cord. Everything needs to be energized and everything needs to be maintained. Okay, so my path today is really to show you a direction that allows that to happen, for you to be able to energize and empower your body to a place that it says, I can handle this. Okay, you're carrying a 50-pound suitcase, you can't handle that. How do I get you to a place that it's 30 pounds? And you go, hey, I can handle that. Hey, you know what, how do we get it to 20 pounds? Hey, I can handle that. And that's really the message of what the body is communicating today. And that's what we're going to talk about, is how do we get that body back to a place of factory settings, or towards that it tips the scale and says, hey, I can do that. And that's really what health is about, is I can do that. And that's what we see with water and nutrition and exercise doing good things for you, are those things. Or I can do that. Those energetic things that we do that are good for us is just looking at the body. We're not looking at it any longer as a power, as a structural system. And the body we're looking at as a battery and energy system, okay? So vertigo, Meniere's disease, dizziness, by mainstream medicine, you go there, I have dizziness, just like you have a broken arm, just like you have some osteoarthritis, just like you have fibromyalgia, just like you have peripheral vision issues, just like you have migraines. You walk in and you have a headache. And the guy runs all these tests and he says, you know what? You got headaches. We call them migraines. Thank you. Okay? So we want to do a different approach here. We want to have a different approach, is that we don't want to just call it something. We want to say, how do we resolve that? And that's what we focus on here, is how do we get you from the cause of the thing to getting it to a path that it's corrected, that your body says, hey, I can handle that. Okay? So mainstream always looks at the diagnosis. That's what they do, is that you walk in and you get a diagnosis. And if somebody calls something A, B, C, D, E, F, G, I looked up dizziness, vertigo, Meniere's disease. There's 10 different types of this and that and this and that. And at the end of the day, none of them serve you any different, because you just go from one specialist to another. This is their first thing. Hey, it goes away. Of course it goes away, because things go away sometimes. Why? Because the body's got some power, just like you get a cold. You rest for a little bit, you twist your ankle, you rest for a little bit, okay? You hurt your back, you rest for a little bit. And the majority of us go on our way after a few days, a week, but those things keep tapping, and eventually those little taps become more repetitive, and we get chronicity and major issues. And if you know somebody, whether it's yourself or somebody that you're with or somebody in your family, you never just get the bomb. You know, the big guy always gives you a lot of love before he gives you the foot. Okay, that's my rule. Okay? Yeah, and I know that because I've had this experience. I'm not making it up, and it's not what I see in people. I have had chronic illness. I know what it's like to get the foot, and I know what it's like to not pay attention to the message. So there's many different types of rehab. There's vestibular rehabilitation, there's canalith repositioning, where they say there's little bones in your middle ear, so small, and they get out of place. That if you do these maneuvers, these Epley maneuvers, and it'll put you all back in place, and off you go. And I always wondered if that's true, that I had these little bones in there and they got out of place, it would make sense that every single football player that have played football, especially a pro, that has gotten their head knocked off at least 1,000 times, every one of them would be walking around like this, hey, throw me the ball. You know, and that can't be. It just can't be. So there's got to be something better for than that, okay? It can't be that I just leave it alone, because if your body's telling you something, I believe it's telling you something. And if you ignore it, it's just not random. I don't buy that, okay? We have to pay attention, right? So if that stuff doesn't work, well, there's medicine, you know, and that just relieves some of the sickness, you know, and that's important. I am pro-medicine for people if they're suffering, but I'm not pro-medicine for long-term corrective resolution, because you can't do that. It just doesn't work, okay? And then the last thing, and it's highly effective, is that they go in and they cut the nerves, okay? They cut the nerves around your brainstem. Well, that just sounds a little rough to me, okay? And you know what? For some people that maybe I couldn't help, that's a possibility, and other people couldn't help, and they've tried everything or whatever it may be, and it's so severe that that's there for them because it's highly effective, right? But you got to pay the price when you start cutting stuff up, that's for sure. But these people that are living so poorly, thank God they have that option. So we're not talking about those people at either end of the spectrum. We're not talking about the people that just had a little bump, because you wouldn't be here if you had a little bump, because this doesn't work that way. Like I said, we have to get beat up a little bit. If your phone broke, if your tire got flat, you would go deal with it right away. But if it's your health, no, I take some Advils and off I go. I forget about it, right? Yeah, well, that's the truth, isn't it? Yeah, it's not wow. And everybody goes, man, I need health insurance, man, because that's going to help me. That ain't going to help you guys. That's the way to bigger problems. Isn't that the truth? Yeah, that's the truth. That way is never the way. It cannot be the way to get fixed. It can't be. You can't put garbage in the body and expect it's going to be okay. Okay? So there's two types of illness in the medical model, in healthcare. There is emergency care, crisis care, acute care. And that is 1% of all illness. I have a heart attack, I break my arm, okay? I fall out of a tree, all right? I get in a car accident, you know, I get a knife, you know, something traumatic that you could go, that bleeding right there is because of that car accident. That bleeding right there is because of that. That broken arm is because I fell out of the tree. Cause, effect. But dizziness, Meniere's disease, there it is. If you look in WebMD, they don't give you what causes it. They tell you what is happening. And that's just a description. That's great. Okay? You wouldn't go to the doctor and he says, great, you have a broken arm. We call that broken arm. Nice to meet you. Goodbye. I'll give you some pills. See you later. No. They can fix that stuff. And that's what the medical model is great at. You know where we rank in the world in accident, crisis, emergency care? Where do we rank in the world? Numero uno. Number one, we're the best. You hurt yourself, you're not going to go to Pakistan to go, okay? You're not going to Ethiopia, you're not going to Moscow, you're going right here. This is it. We are number one, okay? You're certainly not going to Mexico to get your cardiovascular, you know, get your heart transplant. It's just not happening, okay? However, 99% of all other illnesses, which are all the other illnesses, from I got back pain, to I got joint disease, to I got migraines, the dizziness, and all that stuff that nobody could put a finger on, that's 99% of all illness, okay? So 99% of all illness that doesn't have a direct cause is what the medical model ranks 38th out of, I think it's 100 and something industrialized countries. 38th. That's not me, that's World Health Organization. 38th. I couldn't even tell you 37 countries that I would want to go to have health care, right? So we're not doing a good job there. Yet, Americans consume 68% of all drugs in the world. Half of Americans take one prescription on a daily basis. I know that's up. I've heard it's 3. All right. In constant dollars, we spend more than anybody. We have the best schools, the best doctors. They wear these fancy white coats with these little glasses. And guess what? We spend all this zillions of dollars, and we're 38th. So something's not right there. Best stuff. And the reason is, if we're 38th, is because it's the practice of what we're doing that's not working. Okay? So what's gone wrong? Why are U.S. healthcare costs rising faster than any other country, even as health declines?
Because doctors are being taught how to prescribe medication.
Yeah, they've gone off the place. They've gone off their reservation, and they're trying to cover healthcare where they really belong in crisis care and suffering care. Somebody has a migraine. When you have a migraine, you should just give me some relief and then go see Friedman. That will help me long term. That's the approach for today. It's not that it's wrong or right. It's just that the path that they've had the discussion with is just keep giving pill to more pill to another pill, a pill for the pill, a pill for the pill, a pill for the pill. And it's not the doctors that are the issue. It's us. It's us because we don't want to stop and take care of ourselves. We don't want to do it. It's difficult. It's hard. It's hard to do. So the idea is the present model of health is defined by how a person feels. Hey, I feel good. Okay, but everybody probably, I hope you did, you brushed your teeth today. You didn't wait till you need a root canal, right? You didn't go, hey man, my teeth are good today. I'm brushing when I need a root canal. That's ridiculous. But we do that with the most thing that we cherish the most. We should be able to be the dictate and be the destiny of who we are in our own health care. Okay, so I'm going to empower you to do that today. All right? So the objective then becomes to eliminate symptoms. I got a headache, take an Advil. Okay, you have urinary dysfunction, take this thing. Okay, I'll just cramp you all up. All right, that's what's going on. Just cover the symptom. Just cover it up. Okay, and prescription drugs kill over 100,000 people a year. It's a lot of people, guys. You know? Go turn on the TV and see what people are getting all riled up about. Okay? This dog got shot, this one got here. Right. And these are all horrific things. Don't get me wrong. I'm not here to make one small to make the other one bigger. Okay? But this is an epidemic. Okay? This is an epidemic that everybody, and they just keep on going. Just like, you know, it's the zombie movie. That's why I think the zombie movies are on. Is because it epitomizes where we are right now. Up is down and down is up, if you know the prophecy. Yeah. Okay. So death by medicine is the 21st century epidemic, and America's war on drugs is clearly directed at the wrong enemy, Dr. Mercola. Okay? So my feeling is that if the body is sick, that's a negative. It's telling you, it's reaching out to you, it's saying, I'm sick. And we go ahead and we stick a negative in it, which is a toxin. Now it covers it up, yes, we feel better, okay, but it's a toxin to the body. So you can't toxify a system that's breaking down and think it's going to get better. Right. You can't give chemo to a person that is already in absolute last stage, end stage distress and say, I'm going to make them healthy. Can't be. It's impossible. Okay? There's only one possibility. Okay? And that is to make a shift. And the first shift is to realize that your manufacturer, my manufacturer, made us perfectly. And when we own that statement, and not on Sunday only, guys. Right. You can't own it on Sunday and go to the doctor on Monday. Okay? You just can't do it. So we got to look inside. And that starts with the dashboard system of who we are. Okay? Is that you don't drive down the road and have smoke coming out of the hood of your car, okay, and put some sunglasses on. Do you? No. Yeah, you laugh, but you do that to your bodies. Every one of us, me included. You've done it. You've had a pain. You've had an ache. You had a this. You had a that. You just blew it off. Took something, covered up. Yep, a headache, and our favorite expression, yeah, it got rid of the headache. No, it didn't. It didn't get rid of the headache. Okay? It doesn't get rid of the headache. Okay? It just covers up the headache. All right? So, the next piece is to understand that your body's in distress. So, number one, we're made awesome. Number two is we have a dashboard system that speaks from us from beyond this thing here, which is the stupid self. Okay, is our brain. Okay? The smart self inside, the one that runs your breathing, your heart, your eyeballs right now, your digestion that's going on without you thinking, your hands in your pockets, your ability to sit upright, your ability to do this, all that stuff that you're not running any part of. okay? That's only being run by one part of you. And that's the same part that is the one that holds the spark of life in you, and it's also the one that is telling you when you need to pull off the road and you need to take care of yourself with those little taps, okay? And it's through those experiences that we get broken down. I don't want to go down that path too much because we're here to talk about vertigo, but the reality is that if we have enough of those experiences of those backaches, at some point we have an awareness and we go, hey, maybe I should do something about it. The problem is that we wait so long that we're in desperation and we don't do some things in the beginning. Fair? Yeah. Fair. It's just the way it is. I'm no different. I'm only speaking prayer out of my mouth for my own self. Okay? All right. So you have a choice. That's the choice I think you get. Okay? Is that things come to you and you look around and instead of saying, I'm broken and I'm made from the manufacturer this way and I'm all broken and I'm all messed up, is that you actually say, you know what? I'm going to start taking care of this thing because it's talking to me. And you make choices. And you live in a place of kindness to yourself to do it also. That you can do it, because New Year's resolutions don't work. Why? Because people take on more than they should. Okay? So you want to take on some stuff. You got to put some goodness into it. You got to put some positives in. Okay? So I look at the body like a cell phone. All right? It's very simple. We are a cell phone, and you got all these apps running. You got your eyeball app, your seeing app, your smelling app, your tasting app, your heart app, your lung app, your digestion app, your hormone app. All these apps are running. You think they're using some energy, guys? Yeah. You think standing up and moving and shaking and bending and twisting so you don't break down and get squashed by 2,000 pounds of gravity is energy being used? Yeah, even you nodding your head, you need energy for that. Okay? So if we look at the body as a system like your phone, and when you get a low battery sign, what do you do with your phone? Honey, pull off the road, I gotta plug in, right? Where's my cord? Where's my cord? Right, so the body's the same way. The body's the same way, and that's what it does with a cold. What do you think it's telling you? What do you think a cold tells you? Did you catch a cold? Did you catch strep? Did you catch a cold? Do you think that there's no germs in here? Did you go to the ladies' room, men's room? There's germs everywhere, guys. That doorknob is filthy, I can assure you. Okay, it's never been cleaned in its life. All right? Listen, but if you went and you looked at it, yeah. I'm telling you, you can't see it with your eyes. Thank God. Right? Right? Thank God. Okay, so the point is that it's not a matter of catching the cold. Okay, by the way, 85 to 90% of the population has what in their throat? Strep. You don't catch strep. You have strep. Okay? So what's the other half of the equation? Then why, because every one of you, if you were next to somebody, if you had a significant other, then you got a cold and they didn't get it, they got a cold, you didn't get it. Why is that? They're blowing it right in your face. You're eating from the same stuff, you're saying hi, give me a hug, okay? Because it's not about the cold, it's not about the germ. The other half of it is, it's about the power of this body. It's about what you're running, okay? Are you able to sustain? Okay, and if your immune system app is functioning and you got the power to function it, guess what you're made to do? You're made to fight disease. Why? Because we are made right from the factory. There's no mistakes, okay? We just need to take care of ourselves. But we go to, I was talking to somebody today, if you go up on Mansell Road, it's a beautiful site. On one corner, there is a huge building. And you know what it says on top of the building? Krispy Kreme. I am in a little office, okay? And they are selling donuts more than I could sell health. Yeah. On the other side is Jilly's Donuts. Okay, Jilly's Donuts, okay? On the other corner is, guess what? Eckerd's. Okay? And then on the other corner is a barbecue place. So if you look at all those things there, and if you drive down the road, you'll see the medical place, okay? You'll see all these things that we're not taking care of ourselves, and they're just right there. And that's the choice that we get. The choice is to follow that Sunday route or the Monday route, okay? So we have a choice, okay? And the choice is to first have an awareness that that thing is speaking to us and it's telling me something that I need to pay attention to. Because if you don't pay attention to it and you avoid it and you ignore it, guess what do you think it's going to do? It does not let go. And if you're old enough, and all of you know that except these two little kids, all of them know that if you don't pay attention, it's just going to come back. Yeah, it has to be. It's because otherwise, it's not there to punish us. It's there to wake us up. Okay. So eventually, we get to a place where we just keep using and using and using, and guess what happens? We got nothing left. So we start with the colds, and the kids that gets the cold, and they get the ear tubes, and they get the antibiotics, and then they get the steroids, and now they're on Ritalins and all these medications, and before you know it, the body starts showing distress, and they start with the coughs and the hacks and the this, and the immune problems, and then they got the aches and the pains, and then they grow up as adults because they've been taking pills their whole life, and they're sick adults, and that's what we're breeding right now, okay? So, it's unfortunate. So, why is this important in today's conversation, and where do I fit in? Is that the posture app, the ability to stand up against gravity, is the largest energy user. It's the largest app you have. Just think about it. Is your heart beating when you're young, when you come out of the pot, or are you walking? Okay, so walking takes a more power. You got to learn how to do that, to coordinate those systems, and to be able to hold that balance. So the human body, using posture, is the largest app, the largest energy user. Okay, it's the movie app, guys. It's not the calculator. Okay, so it's using a lot of juice. All right. So if we look at the body as a cell phone, and we realize that this app is just really using a ton of energy, and if I don't have enough energy, those other apps can't function well, and we start getting those messages saying, hey, low power. So in this office, we look at posture to say, hey, let's remove that stress, let's reduce that stress, and let's minimize that stress. Now, it's not as simple that, because what I do is twofold, okay? Not only do I try to restore posture, but when I do that, I allow the body to be in its symmetrical place that actually empowers the nervous system. So it's not something that I just take off stress off the body, I actually empower it at the same time. Okay, so that's what we're going to talk about today. So there's a rule in the universe, and it's this simple. Structure dictates function, meaning the structure of something dictates how well it functions. So let me give you an idea. I break this chair leg, I sit in it, it falls down, it no longer functions as a chair. Okay? I break my computer, it no longer functions as a computer. I stick a hole in my heart, it no longer functions as a heart. It's very simple. Go take a hammer and smash your carburetor before you go drive away, or stick a couple holes in your tire, and you'll see that structure dictates function. There is no other rule that you need to know in your health. Structure dictates function. Okay? So what are you doing structurally? Okay? That's me. Okay? So I'm a structural posture guy, engineer, so to speak. Okay? So I look at restoring the body inside out, not outside in. We don't get gratification outside in. We get gratification inside out. There's a rule. As is in, as is out is also, okay? So if my heart is structurally sound, it's functioning well. If my digestive system is structurally sound, it's functioning well. And if the structure of my body is correct, guess what it's doing? It's functioning well, and it's using the least amount of energy that my body is taking in. And that's important, because when I use too much energy, some stuff, and I tip the seesaw to I don't have enough, from I had enough, that's where the body tells us. And that's that point where the body sends on a light. It starts it out first with little things, little colds, little aches, little pains, and it keeps breaking, and guess what? More apps keep showing up because they say, hey, I can't work, I can't work, I can't work. And then we get to the place where we have systemic disease. So if you have these little chronic pains, okay, these little acute, if you just got one little pain and it just started up yesterday and a week before for the first time, you got nothing to worry about. Leave it there if you want, okay? It'll be a while till it bugs you. But if you notice they're bugging you more and more, hey, you know what, my knee's getting worse, my hip's getting worse, and then man goes ahead and he puts all this plastic stuff in you, and off you go. And if you see multiple places, that's the next piece. And then the piece after that is where we get into like vertigo and the dizziness, because the function of the body and the nervous system is breaking down, and the body doesn't know where it sits in space. Okay? So as we go through life, we get all these taps, and the body starts breaking down, and the energy system of the body tips, and it says, I can't do it, and more stuff shows up. So my deal is how do we get healthy? How do we empower life again? Okay, and how do we start that path? Okay, so this is one of the things that I look at. This was a person that has some inner ear stuff, and it's very interesting, because if you look in like the third or fourth line, it says, as the name implies, BPPV, don't worry about that. That's just a long name for vestibular problem, basically vertigo. Okay, triggered by certain changes in particular position, particularly the head. Meaning, what caused the problem and caused the dizziness when people started turning their head. Must be that looks like a structure thing to me. I move the structure, and it creates an issue. So it's right in the definition on WebMD, but they don't look at that as here's the cause of the head situation, and they don't go to resolve it. Okay? So this is one of the things that we look at. This is a patient that came in with obviously is bent up and sitting over here like this. This is a nasium X-ray, and after a correction, we balanced it. Okay? And it's now the nervous system is open. Brain is receiving information from zillions of cells saying, I'm here, I'm here, I'm here, I'm here, instead of I'm here. And it can't paint that picture, so people get vertigo and dizziness. Okay? So, we have trauma, the body tries to go ahead and compensate for it neurologically, and then over time, gravity and time. And we just, all of a sudden, we wake up one day and we go, dang, Grandma's really leaning forward. So the body always breaks down. Grandma never gets taller, guys, because gravity is the largest stress to the human body. Yeah, Grandma never gets taller. So all this, over this time, we are receiving the message from the structural system and this wisdom that in functional ways. That's the way the manufacturer made it, you know? So I'm not here to say that you never should take care of yourselves functionally. But I'm saying that if you don't take care of yourself structurally, you're missing the biggest app. And if you don't take care of that, you can't have function, because structure dictates function. So if you want to optimize your function, which is optimize your ability to see straight and be balanced and move through space and not have headaches, not have vertigo, not have dizziness, not have the nausea, or to limit it to a smaller wet, you have to look to the structure first. And we don't do that. That's why you're here. Because if that answer was somewhere else, they would have already taken care of it for you. It's because, again, how many awarenesses do we need? Okay? So, the choice is, I do a method called QSM3. I don't have to read this whole thing, but my continued recovery from hell, I'll read at the bottom. To all my chiropractic friends, please check out Dr. Russell Friedman's Technique Quantum Spinal Mechanics 3. In my opinion, it's the most cutting-edge chiropractic technique out there, and I know that my recovery from Meniere's would not have been possible without him. Okay? So this is one of my professors, and he's well known in chiropractic, and he's had multiple chiropractic methods before he came in here. And within one or possibly two adjustments, the vertigo is gone. This is a lady that she just gave us this testimonial last week, okay? February 2017, I'll read it. Shout out to Dr. Russell Friedman of Sandy Springs, Georgia, for giving me my life back. I have suffered from Meniere's syndrome for many years. I saw numerous medical doctors and tried many techniques and medications to help with my condition. She is an RN, by the way. She also lives out of state. Nothing has worked. I was on medications that would drain me of my energy, and I was still having spells. Back last summer, they had started to come more often, 2 to 3 or more spells a week. Nothing was working. Can't live like that. Can't work like that. Can't enjoy like that. One day I read an article on QSM3 spinal treatments and how they had helped others like me with similar issues. I picked up the phone and called. Best phone call I ever made. I paid her $10 for that statement. Okay? I began seeing Dr. Friedman and had immediate success. I still have not had a spell in months, in addition to having also started a healthier lifestyle. That's the thing, guys. That's what I speak for. It's not get adjusted and you get rid of your symptom. It really is to understand that your body's communicating with you, and you want to knock off the big stressors. You don't want to take off one brick. You want to take off 50 bricks at a time, right? That's the one that frees you up, okay? And structure is the biggest problem, okay? If you're suffering from vertigo, migraines, whatever, you need to see him or one of his colleagues to get your life back. No regrets. Bam. Nice, right? Yeah. So that's what we do here. And we look at the posture of the human body. Structure dictates function. We do it with measurability and predictability. And if you're suffering from something that's one of those, that 99%, and you don't have a knife in your ear, or you know, a broken leg, or you know, something like that, then you know, it's a good possibility that this is the path to help you move forward.